but how difficult would it be to relocate the ship, actually either ship, for another hotspot such as New Orleans that may not have been as prepared and may see their cases surge?
Tara, you have a hot mic.
I don't though. I'm on mute.
That's the okay. For all channels, please just ensure that you mute your lines. We'll go with it. Okay. Sam Legrone.
Wait,
Hi, thanks for doing this. Given some of the shortages in medical supplies, particularly in New York City, I mean, I think there's images of PPE, assigned PPE being like a Yankees poncho for at least one case. How integrated are you with the medical systems in terms of sharing equipment, sharing supplies, and responding to needs of some of the local hospital systems, not necessarily with patients, but with material? And then I got a follow-up after that.
I'm sorry. So was that a question for the Mercy or for the Comfort?
It was a question for the Comfort, specifically.
I'm sorry. I apologize.
Okay. We're tracking. This is Captain Emersbach. We haven't had any requests at this point as far as sharing resources or equipment. If that was to occur, that would obviously be coordinated back through FEMA local authorities for the ask. We currently have enough PPE equipment and stores on board to take care of patients here in New York City for the, for probably at least for the next couple of weeks, depending on how many patients we get aboard the ship. And then we have a very robust logistics system in which to get resupplied while we are pierside.
Yeah, just as a follow-up, are you going through the Defense Logistics Agency for resupply and husbanding for both of your, the Mercy and the Comfort, in terms of, I'm just curious how y'all are getting new equipment coming on board both ships. Thank you.
Yes, this is Captain Emersbach on the Comfort. Exactly. DLA is working diligently with us to ensure that we have what we need.
Captain Rochak here. I would just echo that our supply lines are always intact in the Department of Defense and with the Navy in particular. So we're getting supplies as we expect. Thank you.
Okay, Ellen from Snopes.
Hi, this is Ellen Milheiser from Synopsis. When y'all deployed, you stated specifically that you would not be doing obstetric or pediatric cases. But with the number of patients being relatively low and the problem of women giving birth not being allowed to have somebody with them in a hospital, will you be changing that priority at all, do you think?
So, Captain Rochak here. We have not been directed to change our plan of the scope of care that we're going to provide. And just to expand on that a little bit, to provide obstetric care requires a fairly large footprint in terms of both staff and capability within the hospital. So since that was not part of our initial plan, we don't have those specialists aboard. We have the staff that we need to focus on the mission that we said we would deliver. In the event that we were directed to do otherwise, to deliver obstetric care, we'll certainly adjust our staffing mix as directed by the DoD in conjunction with FEMA and move out appropriately.
This is Captain Emersbach on the Comfort, and to echo Captain Rochak, absolutely. We take our orders and directions.
So, Captain Rochak here. We have not been directed to change our plan of the scope of care that we're going to provide. And just to expand on that a little bit, to provide obstetric care requires a fairly large footprint in terms of both staff and capability within the hospital. So since that was not part of our initial plan, we don't have those specialists aboard. We have the staff that we need to focus on the mission that we said we would deliver. In the event that we were directed to do otherwise, to deliver obstetric care, we'll certainly adjust our staffing mix as directed by the DoD in conjunction with FEMA and move out appropriately.
This This is Captain Amersbach on the Comfort, and to echo Captain Rotruck, absolutely. We take our orders and direction from higher authority, and if our mission shifts, we'll do what we can to meet that mission.
Thank you.
Jack from Foreign Policy.
Hey, I'm just curious. I know you're not in a situation right now where you see your beds potentially being filled, but if that is the case, if your caseload surges, do either of the commanders have contingency plans to refer patients to other installations or hospitals? Thank you.
Captain Rochard from the Mercy here. That would entirely be an issue of coordination with our local authorities here in LA. As I mentioned before, we have people from the Mercy embedded within the Medical Alert Center, which is the coordination agency for all inter-hospital transfers. So they would manage that at that level. We would not be managing it here on the Mercy. Thank you.
Captain Amersbach, same here. We go through the Java Center, and all coordination for care beyond what would be provided from the ship would be coordinated through them. Over.
Last question, Ryan.
Just had a quick follow-up. We heard from the Mercy captain about how patients are referred and kind of what that process is like. Captain Amersbach, who is responsible for referring patients to the Comfort? What entity is kind of responsible for making sure that patients get to the Comfort?
Thanks for the question. So the central communications and referral is being ran through the Java Center in New York City. They have local health officials. They're working in conjunction with FEMA to ensure that the hospital-to-hospital transfers are occurring as smoothly as possible. And again, to make sure that those patients that are coming aboard the ship are suitable for our environment, as well as right now COVID-19 free.
Thank you.
Last question, Jennifer.
It's Jennifer Griffin from Fox News. Just a quick follow-up for my colleague Jeff Schogel. Captain Rotruck, he asked about disinformation. Are you suffering from any disinformation campaign about what you are doing? Are you seeing any harm from that? Also, are people just showing up at the docks trying to be treated? Are you having an issue with that? And finally, how do you know all the staff on board both ships? Since you had to deploy so quickly, how do you know that they are all COVID-free? Were they all tested or put into isolation for 14 days in advance? Thank you.
Hi, Captain Rochard from the Mercy here. Thank you for that series of questions. With respect to misinformation, I'm not personally aware of any misinformation campaign with respect to the mission that we're doing here. With respect to people just showing up for care, we've had a few phone calls here on the ship of people that believe they could access care directly as opposed to being patients in a hospital and being transferred. We just answer those calls as appropriate and let people know that the mechanism for receiving care on the Mercy comes from being a patient in a local hospital first. And then finally, we had a lot of measures in place to make sure that we remained a COVID-free ship. We did screening for everybody before they came aboard. After they came aboard, we've been doing all the individual measures that you're familiar with: hand washing, frequent use of hand sanitizer placed widely throughout the ship, the other CDC recommendations that you don't touch your face, that you exercise social distancing to the maximum extent possible, and that you do frequent cleaning of high-touch surfaces. In addition, for new staff coming aboard the ship, since we left San Diego, they're in a period of what we call restriction of movement for 14 days. So they're coming up here to Los Angeles, to the local area, and actually essentially being in self-quarantine or self-isolation, if you will, to ensure that had they been exposed to somebody with COVID and they didn't know it, that would be time for the disease to declare itself. And obviously, we would not have those people come aboard the ship. So that's part of our means of ensuring that any new staff are COVID-free as well. And then, of course, all of our patients are screened and tested for COVID prior to coming on the ship. So we think we have a pretty robust group of measures in place to remain COVID-free, although obviously we recognize that there is always risk inherent.
All right, gentlemen, thank you very much for your time. Members of the press, thank you as well. That concludes today's briefing.
Oh,